We're back with Dr. Silkwood-Sherer from the Physical Therapy Program in the Herbert H. and Grace A. Dow College of Health Professions. I know you're doing some research right now with hippotherapy. Tell me a little bit about what's going on.
Well, the current study we're doing is was an external grant from the Horses and Humans Research Foundation, and it's a multi-center study. So we actually have 4 sites across the country, and we're looking at changes in balance and function in children with cerebral palsy and 3 to 6 years old. Because we think if we can work with them earlier, then we're going to see changes that will last and provide them some basic foundations to be able to do other activities. We're in the 3rd year of that study. We're hoping to finalize it by next year and then start getting some data out on that one. So that's the current one that's happening at the moment.
Gotcha. So what's your next grant in terms of the next step after that? What are you targeting?
Okay, well, I've got a couple ideas. I've also completed research with multiple sclerosis. Again, my interest is in balance and changes in balance, because that then allows people to walk better, do activities of daily living better, those kind of things. And so I've looked also at multiple sclerosis, and we've just finished a small study, because we're looking at a couple things I've looked at is, I've always been asked, well, balance is better, but why? And so we've looked at, can we figure out how the brain changes? We've done one small study. We have some equipment here where we can assess how people use cues from the environment to maintain balance. And we finished one study with adults with MS, and also I've done one study with boys with autism. And in both of those studies, we saw positive changes, that the children used those cues better. They learned to pay attention to them and not ignore them. And so where I'm thinking about going is I'd like to maybe see if we can look at maybe some magnetic resonating imaging, where there's a thing called a functional MRI, which can figure out how the brain paths change a little bit. So I would like to try to go that route, but that means obviously getting some grant money to do that, and to see if that changes after doing hippotherapy. The other thing we'd like to do, the current study we're finishing, is randomized, so we have controls. So people who aren't getting hippotherapy, it's always been one of the problems with the hippotherapy research. It tends to be small numbers. It tends to be they're just getting hippotherapy, and we actually are randomizing the children. So we have children who aren't getting hippotherapy and those that are, so we can compare. Because we do see hippotherapy as an adjunct therapy. It's not separate by itself, and we think by doing that it helps advance the child. And so we want to see if people, so the other thing would be is to get controls, people who aren't getting hippotherapy, to see do they change or not change with traditional therapy.
Right. Well, some of the diseases you would expect them to perhaps get worse over time. So,
correct.
Yeah. So I'm curious a little bit about the functional MRI. And so the area of the brain that's acting at that time gives you information about how they're using their body parts more or less, and you can track changes in that to see. Yeah.
Correct. I'm not an expert in functional MRI, so some of that is doing some research with physicians who do use it. But yes, my understanding is that you can look at the brain. You can see which parts are activating, which parts aren't activating when you ask them to do certain things, activities, things like that.
So in the studies that have been done so far, and you'd mentioned it's more of an adjunct than a primary therapy, but how do the changes from hippotherapy compare to maybe some more traditional balance training interventions?
Well, that's one of the problems. We don't have good studies that actually that have always compared them. We've typically had people not getting therapy and people who are getting therapy. So this current study we're doing, the children are getting their traditional therapy. So we are going to have kids that are getting therapy and those that we've added hippotherapy as part of that. So I think that's going to be the one that's going to give us some of the first information. From personal experience, and this is why I do the research, I think it happens more quickly. I think the children, and once they get that ability to balance, then they are willing to try other things. And so you just see this speeding up. When I talk to other therapists, a lot of times those who get referrals from therapists who don't do hippotherapy, they do it when they think the child is, quote, stuck. I'm doing this and we're not getting anywhere.
Right.
Let's add this. And once they add it, all of a sudden the child makes the gains, and then they go back to their traditional therapy.
So the adding of that is more like an actual therapy session that they would get. So other than in the clinical trials, other than randomizing them to the group, which you wouldn't typically do in therapy,
Correct.
You're comparing two typical clinical situations to know how a person would really respond if they move
Correct.
forward.
Well, and it's like doing other things. A therapist uses a lot of different techniques in the clinic, and we're all trying to figure out which is one better than another. It's the same thing as from a physician perspective. Is the generic pill just as good as the name brand? Okay, so they will run trials where one group gets one pill, one gets the other, and they try to see if there's a difference in response. And this is the same thing. Is this one better or not better? And if it is, then maybe we should be doing this and not doing this activity.
Right.
And so that's kind of what we're trying to figure out.
Yeah. So how do they train the horses? Is there special training for the horses that engage in this? How hard is, how easy is it to train a horse? Or do you need some with specific personality traits, or?
Definitely different specific personality traits. Horses are herd animals, one. And two, they don't like a lot of people around them. And in a therapy session, using the horses, we have, one, I'm not teaching these children to ride, okay? So I have someone leading the horse because I want to manipulate how the horse moves. I want to know if they go around in circles, or they go faster, they go slower, those kind of things, because it changes how much input I'm giving to the client that's on top of the horse. We also have sidewalkers because there is that risk of coming off. And so all of a sudden this horse is surrounded by 3 people and someone on their back. So not every horse is going to tolerate that. The other thing is that horses, every horse has certain jobs. I'm sure our viewers would think about, there are race horses. There are quarter horses who run speed events, but there are people who ride English, which is a very disciplined. There's dressage, and different horses, even across breeds, personalities do better in those kind of things, those different disciplines. And we look at hippotherapy as sort of a discipline, and it's a job. And the horse has to like their job. If they don't like it, they burn out. And so we do watch for that. We mentioned therapeutic riding earlier, and even horses who are good therapeutic riding horses, they don't always make good horses for hippotherapy because they've got to tolerate the fact that someone is controlling them. And as an association, the American Hippotherapy Association, we have standards. And we are careful about how much work the horse does, because it's also mentally exhausting for the horses. And so we want to make sure that they're, they get breaks. They don't work every day. They only do so many sessions a day, those kind of things.
So where do you find the horses? Does a person with a horse farm call you up and say, I have a horse that might be good for this? Or can you make, how do you get them?
Traditionally, they are usually horses that are retired from doing some of the other disciplines, and people don't want to keep them, and they want to have them to do something. So traditionally in a lot of programs, the horses are older. But we as therapists are beginning to realize we really need the younger horses. They're better trained. So some of it is people calling to donate. Some of it is therapists start looking for horses because we do want certain movement. Programs are small, so you want a horse with very symmetrical movement because they're going to be able to treat more clients. If a horse has a slight, let's say, hitch in their walk, they might not work well for one type of client. So you want
too much challenge.
Too much challenge. So you want someone who's pretty typical, and every horse doesn't move exactly the same way. So you'd like to have a couple of horses, 3 if you can get them. And so, yeah, traditionally donations, and sometimes therapists are now starting to go purchase horses. They're looking for, and some people like specific breeds because they're shorter, they're easier to work with. Remember I said sidewalkers earlier? A really tall horse is not great because it's really hard on the shoulders of the sidewalkers because they're having to hold their arms up so high during a session. So you like a little bit shorter horse, a little broader because they can handle more clients. So,
what percentage of your practice is in hippotherapy? Do you that specifically in your practice, or you mix it?
I do primarily. I do hippotherapy. I am not a riding instructor. I never wanted to be one. So I've never took the certification to do that. So mine is hippotherapy. In terms of actual working now with my teaching here and research, I don't do a lot of actual practice in hippotherapy anymore. I primarily am doing research.
So it lines up with your research. So
correct.
Yeah.
So when I do provide services, it's usually research related, and I usually have grad students who want to help. And so then we take, the students go down, they get to learn, they get to help learn how to do hippotherapy, and I provide a lot of the services or supervise them doing it.
Cool. Well, thanks. That's really, really interesting. Hopefully the viewers got some information, and if it works for them, they can check it out.
That'd be wonderful. We'd love to have them.
Thanks.
Thank you.